Good evening, everyone. I will make things short as fast as I can. Today, I will be talking about my experience of Silhouette Soft in the neck and the eyebrows. From my point of view, I think all of us are looking for a safe, high-efficient treatment that meets our patient satisfaction. At the other hand, we have the patient, which they are always looking for shifting to non-invasive procedures with the good results, a very short recovery time. Everyone wants to go back to work, his daily activity as soon as he can, and results that can stay with us for a longer time. So when we choose a Silhouette, actually it gives us the good solution for both of us, for patient and doctors. It gives us a good choice for special areas, especially in the neck and the eyebrows. Sometimes it's only difficult to treat it with single modules of treatment. So when it comes to the neck, can we use the Silhouette Soft for any case in the neck? And the answer is we have to be logical. So when we have a case that is going for a surgical facelift, the only solution we have is surgical facelift. So if we're gonna use the Silhouette in the neck, we always advise our colleagues to go with the cases with mild to moderate sagging, patients with no excess fat at the submental area, and to avoid patients with thick skin, so you can show your results properly. So why we choose Silhouette? It's an non-invasive procedure. We can do it in the office. It gives us an instant, constant result with a good suspension and good contouring for the neck and the jawline. The very short recovery period, and it can be used as a standalone treatment or in combination with other treatment like fillers, Botox, or any other radiofrequency treatment lasers. These are some cases for neck in my clinic. My protocol in the neck, it always goes with threads. I used to use the U technique, thanks to our advisory board since last year. They give us the information about the benefit and of using the straight techniques, so we revert back to the straight technique. So we're using here straight technique on the neck and L technique for the jawline, or I combine it with other treatment like radiofrequency using the Althera. My first technique, it goes with two straight threads of 16 cones. I go and create my entry points at the middle line with 1.5 centimeters of interval, and then I exit it at both sides 10 centimeters away from my entry point. The other technique, especially when I have a case with a double chins, I go from middle line, I go laterally 3 centimeters, I create my first entry point, I use 8 cones, and I go to the exit point, crossing the middle line with 6 centimeters, and then going to the other side, creating my second exit point with another 6 centimeters. And then I insert my second suture, and it gives me like a crisscrossing area in the middle line to avoid, to help me to contour the submental area. This is my first case in the neck. This is a 40-year-old lady. She has a clear sagging in the neck after massive weight loss. I used for her 2 threads of 16 cone straight technique, and that's how she looked like before, immediately after, and after 1 month. This is another case of sagging skin in the middle line. We used 2 threads of 12 cones as an L technique in the jawline, and I used 16 cones as a straight technique in the neck, and that's how she looked like after. This is the third case. It's a difficult case. This case was supposed to go for a surgical facelift. 1 week before surgery, she decided that no, she was afraid. She wanted to look for an alternative. So we suggested for her to go for combination therapy with Althera and Silhouette. I started with radiofrequency with Althera as 1 session for face and neck. And after that, by 1 month, I inserted my sutures. I used 2 threads to treat the neck, but also we inserted some sutures for the nasolabial folds and for the jawline. That's the patient, and that's how she looked like after 3 months. So when it's come to the neck, actually it's one of the difficult areas due to the thickness of the subcutaneous tissue. We have there a very thin layer. The patient came to us in the clinic always with a high expectation regarding these areas. The cornerstone lays just we have to do a proper patient selection to go with our suture. In my belief, it's a combination therapy that gives us the best results that the patient needs. When it comes to eyebrow, the problem there is it changes from year to year according to the fashion. But the fixed need that all women all ask for is eyebrow elevation. Most of us use the toxin as their first choice, but we face some problems there with the failure, with the not meeting the patient's satisfaction with the elevation. The duration of the Botox stays for 4 to 6 months. So my protocol when I work on the silhouette and the eyebrows, I go with the toxin first, and after that, by 10 days, I insert my suture. It gives me more flaccid muscle in the frontalis, so I can control the elevation as much as I want. When I elevate the lateral eyebrow, I just use the L technique. I insert my entry point at the lateral end of the eyebrow. I go 3 centimeters in the body of the eyebrow medially, and then 7 centimeters in the scalp according to how patient needs to see her eyebrows elevated. When I'm working in the eyebrow, we do anesthesia for the whole track, from the entry, the exits, and the pathway itself. If I'm going for the medial elevation, for the middle elevation, I invert the L technique. So I started with the entry point at the middle of the eyebrow. I exit at the lateral side of the eyebrow, and the other 7 centimeters would be up in the scalp. Be aware that if we go more medially, we have the supraorbital and supratrochlear nerves. Just make sure that you're not injuring them. So don't go medially, stay in the middle of the eyebrow. These are some cases in the clinic. This is the 30-year-old female. She was asking for lateral eyebrow elevation. So we started with the toxin, and after 10 days, we inserted 2 threads of L technique of 8 cones. And that's how she looked after it. You can see the wrinkling on the lateral side of eyebrows due to overcorrection. This is the only place in the using on silhouette that we do overcorrection. We do an overcorrection like a 10%, because this will go back to normal in 2 to 3 days. Another lady with 35 years old, she was asking for lateral eyebrow. So we started with the toxin, and then another 2 sutures, as you can see from the drawing, 3 centimeters and 7 centimeters. That's before, and that's after 1 month. Again, 43 years lady, she needs lateral eyebrow elevation after new style she had at her beauty center. So we used the toxin, and after 10 days, I inserted 2 threads on the lateral side. That's how she looked like after. You can see the puffiness and the wrinkling on the lateral side of the eyebrows. That's how she looked like after 1 week, and that's her look after 1 month. She was really happy with the eyelid elevation. So when it comes to the eyebrow, we always go for combination therapy. I always believe in combination therapy. We started with the toxin, and after 10 days, we go just with our threads. Silhouettes, as a self-tailored technique, provide what patient exactly want with a good result and a longer duration. Thank you for your attention.